Good day, so today I will be demonstrating the different procedures of IV fluid therapy. This therapy is a method of supplying fluids directly into the intravascular fluid compartments, thereby replacing electrolyte losses.
So here are the roles and responsibilities of a nurse in an administration of IV. Next are the purposes of IV administration. First, it is to supply the body with fluids when the patient is unable to take adequate amounts by mouth. Next is to maintain the fluids and electrolyte balance of the body. Then, to provide water-soluble vitamins and medications. And lastly, to provide IV access for intermittent or rapidly needed emergency medications. Next are these to consider in giving IV therapy, which includes peripheral IV access should be changed every 48 to 72 hours. Then, no more than 3 attempts at initiating the IV access should be made by a single nurse. Next, vigorous friction and multiple tapping of veins, especially in older adults, may cause hematoma or venous constrictions. Then fourth, do not shave. Shaving may cause microabrasions and can predispose clients to infections. Then instruct clients about signs and symptoms of infiltration, phlebitis, and inflammation. Clients can report early onset to the nurse. Then sixth, peripheral IV access should not be used for administration of medications that are irritants or vesicants. Next are the 14 rights of drug administration. First is the right drug or medication. Next, right client or patient. Third, right route. Fourth, right dose. 5, right frequency or time. 6, right assessment. 7, right approach. 8, right education. 9, right evaluation. 10, right documentation. 11. Right to refuse. 12. Right principle of care. 13. Right prescription. And lastly, right nurse clinician. Then, before proceeding to the procedures, we will be preparing all the needed materials, which are the correct IV solution, administration set, extension tubing, alcohol, disposable gloves, tourniquet, arm board, non-allergic tape, IV pole, sharps container, sterile gauze sponge, transparent dressing, and tag time tape. Now we are ready to proceed to the following procedures. First thing is to set up the IV fluid. First thing to do is to verify doctor's order and make IV label. A doctor's order is required prior to implementation of procedures. Then check the identity of the patient. It ensures correct solution to be administered to the correct client.
I'm Nurse Yen. Pwede ko po ba malaman kung ano po yung name nyo?
Kelly Junicio po.
Okay po.
Next is to explain the procedure to the client and significant others and secure consent. Knowledge of the procedure helps to decrease anxiety and promotes cooperation.
So, ngayon po ma'am, may ibibigay po ako sa inyong gamot, yung D5LR po, 1 liter. Mamaya pong 8 a.m. Para po yun ma-maintain po yung hydration nyo. Okay lang po?
Okay po.
Then choose appropriate vein, location, size, and condition. Then next is to wash hand and maintain asepsis throughout the preparation and during therapy. This reduces transmission of infection.
Now, before we proceed to the procedures, we will be preparing all the materials needed. We have here the correct IV solutions, the adult splint, a sterile glove, the tourniquet, the trifuse, micropore plaster, an IV cannula, and lastly the micro and macro dip set.
Check the sterility and integrity of the IV solution, IV set, and other devices. Solutions can be discolored, contain particles, or are expired are not to be used. Leaky bags present an opportunity for infection. Then place IV label on IVF bottle, which includes patient's name, solution type, additives, date, and time. Then open the cover seal of the IV solution and disinfect the port. Make sure that you do not touch the port of entry. It prevents bacteria from entering infusion equipment and the bloodstream. Next one is to open administration set aseptically. Open sterile package using sterile aseptic technique. Then close the roller clamp or the side clamp on the IV administration set. Remove the cup from the spike on the administration set. Then using a twisting and pushing motion, insert the administration set spike into the entry site of the IV container. Then hang the IV container on the IV pole. Then fill the drip chamber at least one half. This creates suction effect. Fluid enters drip chamber to prevent air from entering tubing. Then prime the tubing aseptically. Open the IV tubing clamp and allows fluid to move through tubing. Allow fluid to flow until all air bubbles have disappeared and the entire length of the tubing is primed or filled with IV solution. Then put back the cover of the distal end of the tubing. Then close the clamp. It ensures tubing is cleared of air prior to connection with IV site. Compressing creates suction effect. Fluid enters drip chamber to prevent air from entering tubing. Next one is changing an intravenous infusion. First is to verify doctor's order. Counter-check IV label, IV card and bottle number, bottle sequence, type, amount, additives if any, and duration of infusion. It ensures that the correct solution will be used.
Before I proceed to the procedure, I will be preparing all the materials needed. I have here the correct IV solution together with the alcohol swab.
Then wash hands to reduce transmission of microorganisms. Then explain the procedure to the client as it decreases anxiety and promotes cooperation.
So ngayon po ma'am, may administer po ako or may bibigay po ako sa inyong gamot mamaya. Para po yun ma-prevent po yung dehydration po ninyo. Okay lang po ba yun?
Opo.
Next is to assess IV site for redness, swelling, and pain. Then check the sterility and integrity of IV solution as it maintains sterility of IV fluid. Then after that is to close the roller clamp. Then remove the cover seal of the IV fluid. Then open and disinfect the rubber port of the IV solution as it permits quick, smooth, and organized change from old to new solution. Then remove the old IV container from the IV pole. Then kink under the grip chamber, then remove it from the IV stand upside down. Then, quickly remove the spike in a twisting motion and see to it that you are not going to touch the spike and make sure that you are only holding the drip chamber. Then, using a twisting and pushing motion, insert the administration set spike into the entry site of the IV container. Then, hang it in the IV stand and release the kink. Then slowly open the roller clamp on the administration set and count the drops. It maintains measure to restore fluid balance and deliver IV fluid as ordered. Then discard all waste materials used according to hospital policy, as it reduces risk of infection. Then wash hands to reduce the transmission of microorganisms. Then lastly, document the discontinuation of the IV fluid in the patient's chart. Next one is discontinuing an IV infusion. First thing to do is to verify the doctor's order to discontinue IV fluid. Order is required for procedure.
Before we proceed to the procedure itself, I will be preparing all the materials needed. I have here an alcohol, a micropore plaster, an alcohol swab, a band-aid scissor, and a sterile glove.
Then wash hands to reduce transmission of microorganisms. Then after washing hands, wear sterile gloves. Then assess and inform the client about the procedure. It ensures cooperation during the procedure.
So ma'am, ngayon po, titigil na po natin yung sa IV fluid niyo po.
Then moisten adhesive tapes around the IV catheter with cotton balls and alcohol. It exposes needle or catheter with minimal discomfort. Then close IV clamp of IV tubing. It prevents spillage of IV fluid. Then remove plaster gently. Then without applying pressure, pull IV cannula, then apply pressure with cotton balls and tape. Then inspect the catheter for completeness, which determines if catheter's tip is intact. Then discard all waste materials appropriately to reduce transmission of microorganisms. Then make sure to reassure clients.
Wala po ba kayong kakaiba or may masakit po sa inyo after po nung sa gamot po?
Wala naman po.
Okay po.
Then wash hands to reduce transmission of microorganisms. Then document the discontinuation. It indicates the date and time and the reaction of the client to the medication. Next is incorporation of drug into intravenous fluid. First is counter-check with written doctor's order and make medicine card. Client's overall physical condition and compatibilities of ordered medication dictate type of IV solution used to ensure safe and accurate drug administration. Then wash hands to reduce transmission of microorganisms. Then observe the 14 hours when preparing and administering medication. It allows nurses to give drugs safely and to monitor clients' response to therapy. So the 14 rights of drug administration includes right drug, right client or patient, right route, right dose, right frequency or time, right assessment, right approach, right education, right evaluation, right documentation, right to refuse, right principle of care, right prescription, and right nurse clinician. Next is to explain the procedure to the client, which includes the medicine and action, and check IV site.
I'm Adrian Alo po, and ako po skin test ko po kayo para po sa ibibigay ko po sa inyong antibiotic. And ngayon po, i-check ko po kung allergic po ba kayo sa gamot or hindi.
Then check for skin test of drug or IV incorporation. It detects allergic response to medication.
So nakikita ko naman po ngayon, ma'am, normal naman po kayo and pwede ko na po sa inyo ibigay yung gamot. Okay po.
Then remove the cover of the airway of administration set and maintain sterility. Then wipe off port or injection site with alcohol or antiseptic swab. It reduces risk of introducing microorganisms into bag using needle insertion. Then incorporate the prepared drug. Then return the cover of the airway, cap, seals, bottle to maintain its sterility. Then swirl the bottle lightly to mix the incorporated medicine with IV solution, as it allows even distribution of medication. Then place the IV label. The label can be easily read during infusion of solution. It informs nurses and physicians of contents of bag or bottle. Then regulate the infusion rate as ordered. It ensures medication is given over appropriate amount of time. Then observe and reassure patient.
So ma'am, may nararamdaman po ba kayo ngayon after po nung sa gamot po?
Wala naman po.
Okay po. So very good po.
Okay po.
Then discard sharps and other waste properly as it prevents accidental needle stick injuries. Then wash hands to reduce transmissions of microorganisms. Then document results. Next one is incorporation of drug into Soluset. First is to counter-check with written doctor's order and make medication card. Client's overall physical condition and compatibilities of ordered medication dictate type of IV solutions used to ensure safe and accurate drug administration. Then wash hands to reduce transmission of microorganisms. Then observe for the 14 rights of drug administration while preparing and administering medications. Then explain procedure to the client, which includes medicine and action, and check IV site.
Good morning, ma'am. I'm Nurse Yan po. And may bibigay po ulit tayo sa inyong gamot. Tapos papadaanin po natin siya dito sa Soluset para po maayos po. Tapos, kanina po, in-skin test po namin kayo para po ma-check kung magiging allergic po kayo sa gamot. And so far po, sa tingin ko naman po, normal naman po and negative naman po siya. So, pwede na po natin i-umpisahan po yung gamot. Okay.
First is to check the level of the main IVF and add required IVF as dilution. Then first, open the Soluset. Then clamp first both the upper and lower roller clamp. Then remove the cover of the spike. Then disinfect the rubber injection port of the Soluset and incorporate IV drugs, as it removes microorganisms that could enter container during needle insertion. Then spike the Soluset in twisting motion, then incorporate the required IVF solution. Then hang it in the IV pole. Then open the upper roller clamp. Then you have to run the tubing and put it on a volumetric set up to 50 ml. Then after filling up 50 ml, close the upper roller clamp, then hang it on the IV stand and fill drip chamber for at least half. Then close the lower clamp by using the wrapper. Then remove the distal end of the Soluset. Then prime tubing. Then clamp tubing from the IV bottle and open the clamp of the airway at the Soluset to ensure delivery of medication. Then disinfect rubber injection port of the Soluset and incorporate IV drugs. It removes microorganisms that could enter container during needle insertion. After incorporating the IV drug, kink under drip chamber, then shake it side to side so that the medication in the Soluset will be distributed equally. Then put it on the IV stand. Then regulate the flow rate of IV infusion as it ensures medication is given over the appropriate amount of time. Then place the IV label on the Soluset indicating drug administration as it can be easily read during infusion of solution and inform nurses and physicians of contents of bag and bottle. If incorporated medicine is consumed, clamp airway of Soluset and regulate flow rate of main IVF as ordered. Continuously infuses IV fluid after infusion of medication. Then observe client for any untoward effect. Allows evaluation of undesirable side effect. Then discard sharps and other waste properly. Then wash hands to reduce transmissions of microorganisms. Then document in the chart of the client. That would be all. Thank you.